Now, if we look at boil, a boil, as you know, is an infection. This is usually due to a blockage of the gland. A boil tends to be painful, tender, red, swollen when you press it, and it can be quite small as well. You know, as the gland is blocked, they can tend to get bigger, and they can be easily treated with, you know, cold compresses, for example, or other treatments which I'll mention later. But the good news about boils is that they do tend to self-resolve. Okay, so if you see a boil that's red, swollen, tender, in some cases you might see what we call a yellow spot as well, which tells you that the boil is about to burst to release its contents. Now, similar to a boil, you might have what we call a cyst. A cyst usually has a pocket-like sac that might contain a jelly-like fluid. A cyst, again, is similar to a boil, but it's more deeper, while a boil is more superficial. Now, a cyst can be formed either because you've got blockage, again, of the hair follicle or the sebaceous gland. And in a lot of cases, a cyst does not resolve just like a boil would do. A cyst does not always self-release its contents. And some cysts can actually become infections and form abscesses where they become quite tender, painful and red, and you might notice maybe you get fever or night sweats. If it's an abscess, you usually need antibiotics, or you might need to see a doctor to drain and release the contents of the cyst. And when you feel the cyst, it tends to be quite fluidy to touch, quite firm, but not irregular, or not like a hard mass where you're worried that could this be cancer. So a boil and a cyst, you know, both of them tender, red, swollen, warm to touch. Boil tends to self-resolve, while a cyst in a lot of cases either stays the same or in some cases can form an abscess. Now, speaking about abscess, some women have what we call recurring lumps, where basically they have cysts that tend to form all the time, whether it's due to autoimmune reasons or they keep having blocked sebaceous glands. There's a condition called hidradenitis suppurativa, and these are chronic conditions where they tend to have flare-ups now and again. And with this sort of condition, hidradenitis suppurativa, you would usually need to go on long-term antibiotics. Some people actually need surgery, and you would notice that there is lots of scarring of the armpit, and some women actually have hidradenitis suppurativa in the groin regions as well.